doctor.
When expectant mothers visit specialists at Mediclinic Kloof, many are surprised to discover that a lot of the tried and tested bits of advice they've received from friends and relatives simply isn't true.
Previously, mothers was told to take it calm, relax, eat for two, don't do any exercises. These days, women are more informed. They are body conscious, so they don't pick up a lot of weight. They want to have a healthy pregnancy, a healthy baby. Also, the myths previously was that you're not allowed to dye your hair, hang washing, do your nails. You're not supposed to look great. These days they can. If you picked up a lot of weight, your baby will be big, and the chances of having a cesarean section if you planned a normal delivery is increased. Also diabetes in pregnancy, that entails preterm deliveries. So definitely there is an effect of your lifestyle.
You probably won't feel like running a marathon, but getting regular exercise is essential for a healthy pregnancy.
So from 4 months of pregnancy, we don't want to do any exercises lying on the back because that places pressure on the arteries carrying the blood. So when we do the abdominal exercises, we're going to do them in a sitting position. You can also do them in a side-lying position. So Ingrid, you're going to sit with your hands behind you. Good. Bending your knees. Okay, now rounding your back, pull the belly button in and relaxing your shoulders. Now lifting your right leg, keeping it bent 10 to 15 times. Good, and then we're going to swap to the left leg. Good, and then we can increase the level of difficulty by lifting both legs together. So again, rounding the back, tummy in. Can you feel how much more this works? Good. So we want to keep the back rounded just to make sure that we're working more into the abdominal area and less into the hip flexor area.
Experts suggest that pregnant women should get at least 2.5 hours of light to moderate aerobic exercise each week.
One of the most important do's is to ensure that you drink enough water during exercise, that you don't become dehydrated, and also to not exercise at too high a level. The rule of thumb generally is to keep your heart rate at about 150 beats per minute if you're doing cardiovascular exercise. However, if you are fit and you have been exercising and there's no contraindications, then you can go above that. But basically, we don't want your internal temperature to increase too high, and especially in the first trimester. Marika, I'm going to show you an upper back exercise. It's important to strengthen your upper back to maintain good posture throughout pregnancy, and afterwards while you're carrying the baby, that you don't end up crouching and getting more backache. You're going to have one hand on the table, your weight in your other hand, lean slightly forward, keeping your stomach in and shoulders back and down the whole time. You're going to lean forward and lift the weight up and down.
A slightly greater calorie intake is required as they pass through each trimester, but the quality of the diet is far more essential.
You get bombarded with information the moment you fall pregnant. When you send your little info to your medical aid, they start sending you information, and even if you get slightly stuck, if you're sitting in a restaurant, you grab your phone, your smartphone, you quickly Google, can you eat it? And people think you're mad, but you're just a little bit overprotective over the baby. You can't really help it. But there is stuff that people have different opinions on. You just don't know what's right.
Constipation, another common pregnancy-related ailment, is easily overcome by drinking water, exercising, and enjoying a fiber-rich diet.
A lot of people feel you eat for two when you're pregnant. Is that true?
You know what, that is a common misconception, and many young mothers think that they actually have to take in extra calories to allow development and growth of the little one. During the first trimester, you actually don't need any extra calories or protein as long as you had a normal BMI.
Every book and article I've been reading speaks of oily fish and that you have to take a lot of oily fish in.
The benefits you get from oily fish is very important for brain development and eye development of your little one.
Your best bet for a healthy pregnancy is to ensure that you strike a wholesome balance with your diet and get enough exercise. It'll serve you well for your 9-month tenure and help you bounce back sooner after birth.
Doctor.